if you eat, you need enzymes. So that's pretty much everybody, right? The thing is that there is a huge connection between gut health and overall health, period. As well stated back thousands of years ago, disease begins in the gut. But not just disease begins in the gut, but health begins in the gut as well. Because your gastrointestinal lining is that gatekeeper between what is outside coming in and our internal environment. And one of the things that our body needs is to be able to digest our food properly. You've all heard of that phrase, you are what you eat. Well, not necessarily. You are what you eat and what you're able to absorb and also eliminate. Because you could eat, but if you're not digesting, you're not absorbing, and you're not eliminating, then you are toxic. And that toxicity, we like to call that at transformation the ripple effect of disease. So at the core, you have gut function, gut health. And if at any moment that gut becomes dysfunctional, then there's an outer ring that has toxicity. So you get toxicity starts accumulating. And then once toxicity accumulates, there's an even larger outer ring that has inflammation. So gut dysfunction leads to toxicity. That toxicity leads to inflammation. And that inflammation then has a bigger circle around it that goes to all systems of the body and creates an imbalance. Imbalance where? Well, the imbalance is going to come in that system of your body that is most vulnerable, or that by genetic predisposition through hereditary conditions triggers that condition to turn on. So gut dysfunction leads to toxicity. Toxicity leads to inflammation. Inflammation leads to imbalance. Imbalance where? It can be in your musculoskeletal system. It can be in your endocrine system. It can be in your skin. It can be, liver, kidney, any organ that, because of your lifestyle and because of your genes, is more vulnerable. And it could be one system, two systems, or all systems of the body. I've never had a patient come into my office saying, I feel this way, and it just started yesterday. Every patient that walks through my door has had these things turn on, and they've been affected with XY condition for years, decades, maybe even all their life. So the question is, when was the last time you felt well? And usually, patients say, well, it was when I was a child, or when I was a teenager, or, before I had my children, and everything started going downhill. So these things are things that start getting worse and worse and worse, but they all have this trigger. They all have this beginning in the gut. And again, if you're not digesting properly, you're not going to absorb properly, and you're not going to eliminate properly. And that's where enzymes come in. Enzymes not only help us digest our food, but enzymes, when taken on an empty stomach, proteolytic enzymes, proteases, which are enzymes that digest proteins, when you take these proteolytic enzymes on an empty stomach, they're absorbed intact into our circulation, and your immune system recognizes it as an aid, as a nutrient, as something that it can use to combat inflammation, systemic inflammation. And, the one common denominator of any condition that walks through my door is inflammation. No matter if you call it metabolic disorder, cardiovascular health, rheumatoid arthritis, cancer, they all have a common denominator, and that is inflammation. And proteolytic enzymes, when taken on an empty stomach, have anti-inflammatory properties. So that's why I recommend enzymes.